In this video, we'll break down Medicare Parts A and B and show you how to cover the gaps with Medicare Supplement plans and Medicare Advantage plans. We'll also highlight some of the key differences between the two. Hi everyone, my name is Micah. I am a licensed independent insurance broker. My team and I work all over the country supporting seniors and Medicare beneficiaries on their journey to finding the perfect Medicare coverage for them. So, Medicare has three main parts: Part A, Part B, and Part D. It's important to understand that Parts A and B are benefits provided by the federal government. Part D is not a government benefit, and most people will have to obtain it from an insurance company. Medicare requires that you carry qualifying prescription drug coverage to avoid penalties, even if you don't take any prescription drugs. So let's break down Part A. Part A covers inpatient hospital visits, which are overnight stays in the hospital, skilled nursing, which is different than long-term care, hospice, and home health care. So if you've worked for 10 years and paid into Medicare, you have a $0 monthly premium for Part A. The deductible is $1,632, and that's not per year. That's actually for every 60 days, and it can reset up to 5 times per year. For hospital stays, once you meet the deductible, you'd pay $0 for days 1 through 60 in the hospital. For days 61 through 90, you pay $408 per day, and for days 90 and beyond, you start using your 60 lifetime reserve days, which cost $816 per day. Once those are used up, you pay all your hospital costs. Next, let's take a look at Part B. So this covers doctor visits, outpatient hospital visits, preventative care, durable medical equipment, and Medicare Part B drugs. Most people will pay $174.70 per month for Part B, but this can vary based on your income. The Part B deductible is $240 a year, and Part B covers 80% of your medical bills, meaning that you have a 20% coinsurance. So it's important to understand that there's no max out-of-pocket on Medicare Part B coinsurance, meaning that there's no annual limit on your 20%. This means that if you receive a $1 million medical bill, you could be responsible for paying 20% of that, or $200,000. Original Medicare can be very expensive. So how do we cover these costs? One way to cover these costs is with Medigap plans, also known as Medicare Supplements. So these plans work alongside Medicare to help pay the co-pays and co-insurances. When you enroll in a Medigap policy, you also need to enroll in standalone Part D drug coverage. Medigap has the benefit that you can use it anywhere in the country that accepts Medicare, which is almost everywhere. Premiums for a 65-year-old typically range from around $80 to $150 per month, depending on what plan you pick and where you live. Now, this is in addition to your Part B premium. You'll also have to pay a premium for your prescription drug coverage. Medigap has the benefit that you can use it anywhere in the country that accepts Medicare, which is almost everywhere. There's no networks, no restrictions on what doctors you can see. As long as Medicare approves your service, your Medigap plan is obligated to make the coinsurance payment. Once you meet your plan's specific criteria, you generally have little to no out-of-pocket costs. However, premiums can and will increase every year. Companies can increase their premiums at different rates, and some Medigap plans, specifically Plan G, have seen steeper premium increases in the last year compared to alternatives and comparable plans like Plan N. Medigap supplements only cover what's covered by original Medicare Parts A and B. In most states, and you should check if your state's one of these, when you first get your Part B entitlement and you are 65 and older, you're given a 6-month initial eligibility window where you can enroll in a Medigap plan and get a guaranteed issue at a preferred rate. Meaning, you can pick any plan from any company you like, and you're guaranteed to be accepted into that plan at a preferred rate, regardless of your health history. Now, if you attempt to switch plans after this period, you'll be subject to medical underwriting. So this means that they'll ask you questions about your health, which can impact the rates they offer you and may also cause them to deny coverage altogether. Therefore, once you sign up for a Medigap plan, it's unlikely that you'll be able to easily switch plans or companies after that initial eligibility window closes. Another way to cover these costs is with Medicare Advantage plans, or Part C. These plans replace your original Medicare with a managed care plan offered by an insurance company. You're still enrolled in Medicare Parts A and B and must continue to pay your Part B premium. When you go to the doctor, you're receiving your benefits of Medicare A and B from your Advantage plan. Your doctor no longer bills Medicare directly, they bill your insurance company. And you use your Medicare Advantage plan card when you go to the doctor. These plans must offer at least the same coverage as original Medicare, and most Advantage plans also include prescription drug coverage. On an Advantage plan, you pay co-pays and co-insurances. Advantage plans have an annual out-of-pocket maximum, which is the most you could pay in a given year for co-pays, co-insurance, and deductibles. A lot of people are surprised to learn that your prescription drug costs do not count towards this out-of-pocket maximum. Many Advantage plans are available at low monthly premium and include comprehensive benefits not covered by original Medicare. To provide these benefits, Medicare Advantage plans use networks like HMO and PPO networks. With an HMO network, you must use doctors that are in the network. Doctors that are out of the network, there is no coverage. With a PPO plan, you can see both in-network and out-of-network doctors. However, when you see a doctor that's out of the network, it's generally at a higher cost. Medicare Advantage plans use prior authorization, which is a requirement that your health care provider obtain approval from your insurance company before a specific service or medication will be covered. You can switch Medicare Advantage plans every year during the annual enrollment period, which is October 15th to December 7th. There is no medical underwriting with Medicare Advantage plans. As long as you're enrolled in both Medicare Parts A and B and live in the plan service area, you'll be accepted into the plan. So in summary, both Medigap and Medicare Advantage plans require you to pay your Part B premium. With Medigap, you pay higher premiums up front for minimal out-of-pocket costs later. And you must also enroll in Medicare Part D for your prescription drug coverage. In contrast, Medicare Advantage follows a pay-as-you-go model with co-pays and co-insurance. It typically includes your drug coverage. Medigap plans have no networks and fewer restrictions, but come with higher premiums, while Advantage plans have networks, more rules, and usually include comprehensive benefits. You can switch Medicare Advantage plans annually during the annual enrollment period from October 15th to December 7th with no medical underwriting. However, switching Medigap plans after your initial enrollment period will require medical underwriting in most states. So if you're trying to decide what direction to go with your Medicare coverage, clearly this is not so simple. You want to carefully consider your doctors and hospitals, medications, personal family and health history, how much you value comprehensive benefits versus how well you deal with rules and restrictions, your geographic area, your financial situation, and finally your inherent attitude towards how you address risk. These are all things my team and I take into careful consideration when guiding you to find the perfect Medicare coverage for you. If you'd like to reach out to us for support, please give us a call or send us an email and we'd be delighted to speak with you. Our services are 100% free and we're currently offering free 30-minute Medicare consultations. If you found this video helpful, please give it a like and remember to hit the subscribe button for more content to come. Until next time, it's been a pleasure. Thanks for tuning in